everybody, Dr. Diane, your Libido Doc here today, talking about the impact of inflammation on your libido. Chronic inflammation can cause a wide variety of health issues, and libido is one of them. So for example, when we have an overgrowth of certain good microorganisms in our large intestine that have mobilized to the small intestine where they're not supposed to be, this can create a condition called small intestinal bacterial overgrowth. And you might be wondering, like, okay, that sounds like the small intestine. What does this have to do with libido? But it actually has a lot to do with it. When we have these types of overgrowths, they can release these toxins that we call endotoxins in medicine. And we see that endotoxins create a chemical process of inflammation in our body that is directly correlated in research to a decline in libido. So we want to remember that low libido can be caused by chronic inflammation. And when I first started seeing libido go away in the earlier parts of my medical practice, I was treating these other things. And so I would be treating the gut, I would treat the thyroid, I treat toxins, I treat mold, I treat infections, I treat all these different things. And then people would come in and be like, Dr. D, my sex drive's back, my libido's, my wanted is back. And I see this so much of the time that when we can get to those root causes of that inflammatory cascade, then the inflammation does not start going against, say, attacking our nerves, like our pudendal nerve, our vagal nerve, our pelvic nerves. Inflammation can actually lead to blood flow issues in our arteries. I talk about that in earlier videos that I did this month. So we want to make sure that when we are thinking about low libido, we're remembering that anything that can contribute to this inflammatory cascade in our body can actually contribute to low libido. So when we're fixing our sex drive, we do want to think about all these things. We want to think about alcohol. We want to think about blood flow. We want to think about hormones. And we want to think that if we're waking up and our hands feel inflamed, if our joints feel inflamed, if our brain feels foggy, that whatever is the thing that is creating those symptoms is probably also creating inflammation leading to that low libido. So absolutely want to consider the whole body. Remember, low libido is just a symptom. And so the other things I talk about on my channel when it comes to infections and toxins and gut health and all the physical root causes of low libido, those could be inflammation. So make sure you go back and listen to the other videos on this channel where I cover some of those things. And remember, if you fixed all the things from the physical standpoint and you still have low libido, then we absolutely need to start looking at some of the psychological things, some of the personal things. I taught a class recently called How to Have the Right Kind of Sex, which is really about how to ask for your own needs and preferences, how to know what your own body, your pleasure body responds to, right? So inflammation, of course, is only one of many things. But if you are waking up, if you're feeling inflamed and you're feeling puffy and you feel like, yeah, there's inflammation in your body, that's affecting your libido too. All right, everybody. Thanks so much. Please do subscribe. Please remember to check out my podcast, The Libido Lounge, as well. We're doing a lot of promotions and giveaways this summer. It's sexy season this summer. So sexy season is really about, hey, you rate us, you review us, you send us a screenshot of that. And I'm talking about the podcast. So you rate the review, the podcast, you send us a screenshot of that. We have almost 24 giveaways at this point. We have so many giveaways for people that are rating us and reviewing us. Tons of classes, tons of courses, tons of information about how to improve your libido given out by myself, given out by the amazing intimacy expert Susan Bratton, and more. Stay tuned.